Welcome to this explainer. Look, if you've recently started sleep therapy, you might be glaring at that machine on your nightstand with some serious resentment right now. And honestly, it makes total sense. Between the constant hissing sound in the quiet of the night, the totally foreign sensation of silicone strapped to your face, and that unnatural feeling of breathing against forced air, it's a massive adjustment. But today, we're going to break down exactly why your new CPAP machine is causing you so much frustration and, way more importantly, how you can fix it. We'll cover the most common side effects from those first few weeks, the actual physical mechanics of why they're happening, and give you the exact tools you need to take back control of your sleep. Let's get into it. Okay, so here's our game plan. First, we'll talk about the reality of the adjustment period. Then we'll identify the specific mechanical culprits behind your discomfort. After that, we'll build out a troubleshooting toolkit you can literally use tonight. And finally, we'll draw a clear line between normal growing pains and when you actually need to call a doctor. So let's just address the elephant in the room right away. Is it normal to absolutely hate your CPAP when you first start? Listen, if you or maybe your partner are feeling completely overwhelmed by dry mouth, noisy leaks, or skin irritation, I want to reassure you right now, this early struggle is entirely normal. Think about it. You're introducing pressurized air into a deeply unconscious biological process. Your body has been breathing one specific way its entire life, and suddenly there's all this friction. It is bound to push back a little at first. It doesn't mean the therapy is failing, and it definitely doesn't mean you're doing something wrong. It's just a normal part of how our bodies adapt. Which brings us to part 1, the adjustment reality. 2 to 4 weeks. Keep that window in your head, because that is your crucial adjustment period. Most people find that their early symptoms ease up significantly within this time frame if they just keep using it consistently. But why does it take a month? Well, your body is juggling 2 huge things at once. First, it's physically adapting to a continuous flow of air. And second, your brain literally has to rewire its sleep habits to ignore having something resting on your face all night. Your nervous system has to learn that this new setup is actually safe. So a lot of these side effects aren't a defective machine, they're just your brain and body trying to figure out this new normal. And here's where things get really frustrating. Doctors often completely fail to warn patients about these early side effects. This lack of preparation happens way too often, and honestly, it's a huge disservice. It means you might find yourself wide awake at 3 a.m., dealing with severe nasal dryness or startling mask leaks, feeling completely alone. And when you're sleep deprived, every minor annoyance feels like a total catastrophe, right? It just compounds the physical symptoms and leaves you feeling so discouraged. But just knowing that this first week is notoriously tough, that it's a shared hurdle pretty much everyone faces, is honestly half the battle. Okay, moving on to section 2, identifying the culprits. Let's figure out why this is happening. Let's take the mystery out of this. If we strip away all the different complaints, most side effects really just trace back to 3 specific mechanical culprits. First, the air is too dry, which aggressively irritates your nose and mouth. Second, your mask seal is poor, which lets air escape, creating this high-pitched squeal or even blowing air straight into your eyes. Or third, the pressure itself just feels way stronger than you expected. And these things feed into each other. Like if you're a mouth breather, that forced air completely bypasses your nose's natural humidification system, making the dry air issue exponentially worse. Or if you're a side sweeper, your pillow can easily shove the mask off center, ruining a perfect seal in seconds. Now let's talk about aerophagia. It's a fancy word for a highly specific and super uncomfortable symptom, swallowing air. Basically, you wake up feeling intensely bloated. So why does this happen? It's just physics. Your esophagus has a little sphincter that naturally keeps air out of your stomach. But when your CPAP pressure is set just slightly higher than the natural resistance of that sphincter, the air takes the path of least resistance. Instead of going entirely into your lungs, some of it gets forced right down into your stomach. Realizing this changes the machine from some mysterious enemy into a simple physics problem. And hey, physics problems have simple solutions. That leads perfectly into section 3, the troubleshooting toolkit. Let's get you some actual fixes. Honestly, you might want to pause this explainer right here and grab a screenshot of this matrix. It is basically your cheat sheet. Matching your specific symptom to the underlying cause is the absolute fastest way to get relief. Let's walk through a couple so you get the logic. Say you're waking up with a severely dry mouth. The cause? Probably a low humidity setting, or your mouth is popping open while you sleep, letting the air out. The fix is super straightforward. Crank up that humidifier, try a chin strap to keep your jaw closed, or maybe switch to a full-face mask. What if you've got painful red marks on your nose? That's almost always the wrong mask size or cushion style.
which is making you over-tighten the straps. You might just need to swap to a memory foam seal or a nasal pillow to distribute that pressure differently. It's all about systematically matching the physical problem to a mechanical solution.
So implementing these 6 simple steps can dramatically improve your comfort in just a matter of nights. Take step 6, for example, asking your provider about the ramp feature. This is a total game changer. The ramp feature starts your therapy at a much lower, gentler pressure, so you can actually fall asleep naturally, and then it automatically ramps up to your prescribed pressure once you're already out cold. Brilliant, right? Then look at step 5, wearing the mask while awake. Please do not underestimate this one. Wearing it for just a few minutes while you're reading a book or watching TV lets your conscious brain process the sensory input without the panic of trying to fall asleep. You're building your tolerance in a totally low-stakes environment. Just remember, try to make one change at a time so you actually know which tweak solved the problem.
Finally, let's hit section 4, drawing the line.
We really need to establish a clear boundary between normal adjustment pains and clinical red flags where you absolutely must call a professional. Mild discomfort, light pressure marks, small transient leaks, these are totally normal parts of that friction we talked about earlier. But you should definitely consult your sleep specialist if you experience things like severe chest pain, frequent nosebleeds, or massive air swallowing. Why? Because severe chest pain might not just be muscle strain from the pressure. It could be an underlying cardiac issue or lung hyperinflation that needs immediate medical clearance. And frequent nosebleeds? That means the delicate capillaries in your nose are sustaining real damage from chronically dry, fast-moving air. Seriously, do not try to just power through those painful symptoms. Call your doctor.
I want to leave you with this really crucial message because this therapy literally saves lives. If you ever hit a wall and feel like quitting entirely because the mask is just unbearable, please remember that therapy should absolutely not remain painful. The vast majority of these side effects trace back to those simple mechanical culprits we discussed: fit, humidity, or settings. They are temporary and they are highly fixable. Always talk to a professional to adjust your settings before you give up. There's almost always a combination of tweaks that will make this work seamlessly for you.
So, looking back at our troubleshooting toolkit, what is the one small adjustment you're going to try tonight? Are you going to bump up that humidifier to save your sinuses? Maybe loosen and readjust those mask straps? Or are you just going to wear it for 5 minutes while reading to start training your brain? Pick one thing, test it out, take control of your sleep journey starting tonight. Thanks so much for joining me for this explainer, and hey, here's to a much better night's rest.